This is a video about the French medical system, or at least our experience with it. And behind me we have the big medical center in Grenoble, very modern. Across the street, behind the trolley, you can see the old original hospital. I think they're still using some things. Anyway, our impression of the French medical system is very favorable. We are a family, an American family from California that has lived in Grenoble, France for 2 years now. In the US, we experienced high deductibles, super high costs within the deductibles, spotty coverage, balkanized medical records, impersonal assembly line medical treatment, GoFundMe campaigns, medical bankruptcies, and even homelessness. We didn't experience personally all those things, but we saw them often firsthand. We are a family of 4, 2 teenage sons, and mother and father. First of all, the cost is much cheaper. Typically 1/5 to 1/10 the costs in the US. When we first came to France, before we qualified for the French medical healthcare system, we had private insurance with a deductible. Even then, the costs we experienced were nominal. For example, $25 for doctor's visits, 25 euros I should say. And the doctors would actually apologize to us when they learned we had to pay out of pocket. As I mentioned, our impression has been very favorable regarding the quality as well as the cost. It's more efficient, yet more personal. Record keeping is uniform and connected with your medical card, which is called the carte vitale. At least that's the American pronunciation. X-rays, MRIs, lab tests all seem very good at getting you in and out with a minimum of wait times. Primary care has been very personal. The offices tend to be smaller and more modest than they are in the US. And we have developed a more personal relationship with our primary care doctor than we had in the US. Our primary care physician seems to take more time with our matters and go the extra mile more than we received in the US. I don't think doctors make as much money here, but they're not less competent. They seem to be people who are in medicine not to make money, but because medicine is what they want to do. Contrary to American mythology, we have not experienced any long wait times here. Appointments and treatments have been very quick. I'd say in the 2 years since we've been here, we have been moderate users of the medical system. We've had an overnight emergency room visit, which involved an overnight stay at the hospital. We had a small cancer scare, had MRIs, we've had x-rays for sports injuries. One of our sons is undergoing sports physiotherapy. And of course, we've had all the COVID shots and that sort of thing. The COVID treatments have been efficient, timely, and accessible. The EU was maybe a little more cautious than the US in approving the vaccines, but only by a couple of weeks or so. The pharmacies seem like a much more integrated part of the healthcare system. They're small and personal, not like CVS or Walgreens in the US. The pharmacists are professional and knowledgeable. The pharmacies here provide a wide variety of services. For example, foraging for mushrooms seems to be a French passion. You can take the mushrooms to a pharmacy and they will tell you whether they're edible or poisonous. Behind me is the pharmacy that we most often use. Behind us is another pharmacy, as well as the medical building. Actually, it's not a medical building. It's a building where our primary care physician has her office. This is quite common. Even in our residential building, there are doctors. A word about dental care. Our experience has been very good. My wife had to have an extraction and replacement. My son had to have extensive orthodontics. Both were professional and efficient and more affordable than in the US, though not covered by our healthcare plan. We maybe have been lucky, since we have heard that there is a dentist shortage in this country. One of the things that's been an unexpected advantage in our healthcare is that all our healthcare providers are either in walking distance, bicycling distance, or public transit distance. The French complain that their healthcare system used to be better. I can't speak to that. Creeping privatization and resultant inequality seems to be happening in every country. Capitalist forces are ever at work to hoard ever more resources from working people. Another benefit is that medical record keeping is centralized. It's connected with your carte vitale, and any doctor anywhere in the country can quickly pull up your medical record. At least that's my understanding. Compared to the US system, it's wonderful here. I'm finally at ease about my family's use of medical resources. In the US, I would cringe regarding potential financial impacts every time someone got injured. Overall, it's more efficient, more personal, it has equal or better quality, and is far less expensive and worrisome. At least that's been our experience. Now a little bit about qualifying for the medical care system here. I have Polish citizenship through my father, which gave us EU residency rights. Upon arriving here, we were told that it would take 3 months to qualify for the medical, to be part of in the universal care system here. So we started with private insurance. We had both Aetna and Cigna international plans. They had a deductible, small compared to our US deductible. But as I mentioned, the costs within the deductible were so cheap, it was essentially nominal. I can see why for a young single person, that person might try to go without insurance, but here. But for a family, that would not be prudent. Anyway, as I mentioned, we repeatedly heard that we would qualify for the medical system within 3 months of living here. So at the 3-month mark, we made our first application, but were rejected. It was a mystery to us why we were rejected. We were helped by a wonderful relocation consultant, and upon making another appointment at the CPAM, CPEAM is an acronym for the I don't know exactly what it is, but it's Assurance Amelie or something like that. At that point, we experienced a breakthrough. And that breakthrough was that in order to qualify, not only do you have to live here for 3 months, but you have to be making, or at least we had to be making, Social Security contributions. For expats who are here because they got a job with a French company, that happens automatically. But for us, we were essentially digital nomads, and we had to set up our business as a French business and make Social Security contributions. Again, we were helped by a wonderful French accountant who did that for us. And I should mention professional help in France is also much more affordable than it is in the US. Well, when better to wrap up this subject than Christmas? Anyway, I thought I'd leave you with a few takeaways. First, regarding quality, the quality of the medical care here in France is at least as good as the US. I'd say our experience is it's been better, more personal, and equal in every other measure. Speed and accessibility, it is, again, I think we've generally received our appointments and treatments here more quickly than we did in the US, and it's been just as accessible, if not more. Cost, far better. Even if you're not insured, it's just straight out, the sticker prices are much lower, as I mentioned. In my experience, 1/5 to 1/10 as much. Finally, regarding insurance and eligibility, the key for us was to set up our business to be making Social Security contributions, and then our application was accepted. So with that, what are you waiting for? Make the move.